Prion disease. One must be particularly careful when autopsying an individual with a known or suspected prion disease. The prion agent is transmitted. There is no known cure. Prions are usually resistant to conventional chemical and physical contamination technique. The highest potential risk of transmission is in a needle stick or other percutaneous injury after contact with a highly infected tissue, although the brain, spinal cord, and eyes have the highest load of prion proteins. Prion protein are also may be dictated in the liver, lymph node, kidney, spleen, possible other tissue. In addition to the regular and proper autopsy precaution, one may wish to hit the following precaution: decontamination, limit attendance at the autopsy to necessary personnel. Use a powdered glass purifying respirator for respiratory protection if available. Remove the brain while the head is encased inside a plastic bag. This will limit aerosolization of fluid. Cover the autopsy table with an absorbent sheet that has a waterproof backing to limit contamination of the autopsy table by body fluid. This will also simplify cleanup. Decontaminate autopsy instruments and saw blade by soaking for 1 hour in 2N sodium hydroxide and for 2 hour in 1N sodium hydroxide. Clean the bone saw by repeatedly wetting with the 2N sodium hydroxide over a 1 hour period. Place the absorbent table and disposable protective clothing in a double-badged infectious waste bag for incineration. Wash a suspected area of contamination on the autopsy table with the repeated wettings of 2N sodium hydroxide for 1 hour. After the brain has been fixed in formalin, the tissue blocks for histology can be placed in 96% formic acid for 30 minutes, followed by fresh 10% formalin for at least 2 days. After histological sections are cut, the knife is wiped with 1 and 2N sodium hydroxide and the knife is then discarded. After the slides are stained and cover slipped, they can be decontaminated by placing 2N sodium hydroxide for 1 hour and then labeled as infectious cruciform Jacob disease. Of note is that prions are not inactivated by formalin fixation or paraffin embedding. Prions may be deactivated by steam autoclaving at 130 to 136 degrees Celsius for 1 hour. References are available for more detailed autopsy procedure and method of contamination in prion disease autopsy. PPE for performing an autopsy is demonstrated in through 293. Although some form of autopsy gown is generally required, some prosecutors will find comfort in the additional safety afforded by the use of arm protectors and a plastic apron. Gloves. The arm protectors are optional, as is the plastic apron. Double gloving is preferred with the cut-resistant glove between the two latex gloves on the non-cutting hand. For a particularly infectious case, a powdered respirator and a bootleg shoe covers are added, depending upon the required task. Autopsy versus brain cutting versus fixed organ review. It may be accepted to done fewer items of protective clothing. Thank you.